Dr. Jones-Poland, we're so excited to have you here today to talk about women's health. Obviously, a lot to talk about in this realm. I want to start, though, before we talk about women's physical health, I'd like to take a few steps back to a barrier that often women face, which is the fact that we have a desire to take care of everybody else around us before ourselves. Let's start there. What do you see a lot in that regard with your women patients?
Yeah, I do see that across the entire age band, to be honest with you. It's still a struggle, even for some of my senior patients, to really take the time to focus on themselves. So it seems to be a challenge for women all across their lives to have the courage to center themselves. But my message is always that the more you take care of yourself, the better you can help everyone around you. And that really your health does matter too. It's not just about helping everybody else. Like your life, your health, your well-being, it matters just because you matter.
Well, and don't they say on planes, put your oxygen mask on first before your kids? I mean, you need to be the healthiest you to be the best mom, wife, sister, friend you can be. Yes?
Yeah, absolutely. So I mean, that's a great message. And I had thought about that as well. To remember that if you're not fully feeling well or taken care of, it'd be hard to reach out and really take care of everybody else. And really, women are really the holders of the culture of the family as well. So when a mom or a woman becomes focused on her health and well-being, it really does trickle down to everyone else in the family. So if a mom or a woman becomes interested in her nutrition, fitness, really everybody else does actually get on board. So really the fastest way to help to integrate healthy lifestyles is start to work with women. Because when women adopt something, it really impacts 4 or 5 more people. Women rarely do anything alone. So when a woman starts to adopt like a plant-based diet or integrating workouts, things like that, they'll be walking with a coworker, going with their friend to the gym, shopping with their girlfriends, coming up with recipes. So it has this massive like ripple effect to the entire community.
Just to completely underscore this before we move on, for moms or any woman out there that's thinking, oh gosh, that feels selfish to focus on myself. Tell us again, I know we're having a little therapy session here, but tell us again why that is so not selfish. It's the opposite, right?
Yeah, well, I mean, I think 2 things on that. So, first of all, there's nothing wrong with being in a way selfish for your health, right? Because women live longer than men, really, to be honest with you. So, and women oftentimes are not as healthy at the end of their lives. So, if they do take the time to prioritize themselves early on, it can have a significant impact later. And then back to our original comment about taking care of yourself so you can take care of everyone else. If that is what really motivates you, then if that's the direction that that you need that mindset to adopt it, then that's perfectly fine too.
Right.
Yeah.
Your focus, I know, is on, of course, a woman being her healthiest self by way of prevention, right? And wellness and being, we say, proactive instead of reactive. What are some of the first steps that a woman can do to really start taking that route?
Yeah, so the most important thing in my mind is to meet with your provider. So to sit down with your primary care physician and really have a strategy session where you understand your age, your individual risk factors. What is your family history? What is your personal history? And then really put that all together in a plan where you say, we're going to do this during your 20s, we're going to do this during your 30s, et cetera, et cetera. So that really there's like a whole strategy to it. It's just like when you think about investing and planning for your retirement, you don't just, pop up when you're 65 and say, oh, I'm going to retire now. You're kind of thinking about it through every decade and you're being strategic. You may, do a little bit of this in your 20s, a little bit of that in your 30s. And I would like women to think about their health in that same way so that they're strategic and then working with a trusted partner, which hopefully is their primary care physician.
So we know Desert Oasis Healthcare doctors truly manage the care of their patients, but just so everybody could have an idea on their own, walk us through some of the big milestones and things that women should get done at each age.
Sure. Yeah, so starting at 21, women should start thinking about pap smears if they haven't, because typically it's about 3 years after sexual activity. And then also starting with cholesterol screening, typically in your 20s as well, because cardiovascular disease starts early. That's when you start to build plaque. And then 30s is going to be also continuing your pap smears, annual blood tests, things like that to monitor cholesterol. And then when you start to hit your 40s, you start to introduce mammograms. At 45 is colon cancer screening, which is extremely important. Trying to see if I miss anything. At 65, we start bone density scans. And then we continue mammograms until a woman has a life expectancy of 10 additional years. And we continue bone densities the rest of a person's life. And then colon cancer screening ends at about 75.
All of this to give you peace of mind, yes?
Oh, yeah, because many of these conditions, if detected early, are very treatable. So we know colon cancer is essentially preventable if a person has a polyp detected early. It's a precancerous lesion. It can be removed, and the person never has colon cancer. So all of these are important screenings so that a person never goes on to have cancer.
And just to help people fully understand, there's a difference, of course, between seeing a nurse or a doctor, and they have options, but both serve their purpose, yes?
Yeah, so nurse practitioners have been an absolute amazing addition, especially in primary care. We really rely on them. We have a shortage of physicians in the United States, especially in primary care. And so over the last decade, we've seen a real boost in the number of nurse practitioners, and they have been just an amazing addition. So in my office, I currently have two female nurse practitioners, and they offer so much access and resource to patients so we can do additional screenings and have additional time in the office where it's just with one provider, there just really isn't enough time. So really nurse practitioners, the way to look at them is really another way of adding more resources, more access, more time to talk and strategize and make sure you're focusing on your wellness. And it's not a deterioration in any of the care. Nurse practitioners, especially in primary care, have been just such a help to patients.
And they, of course, are relaying everything to you, right? To the doctor. So there is that continuity in care.
Absolutely. And like in my practice, I really set the tone for the practice. So if you come to my practice and you see me or my nurse practitioner, she's still going to talk with you about nutrition. She's still going to be talking with you about vitamins. She's still going to be talking with you about exercise because I set the tone for the entire practice. So really any office where you're going and there's a physician and nurse practitioner, the physician is really setting the spirit of the office and sort of the philosophy, the mission, and the nurse practitioners are really working alongside. And so I think you can feel confident that the nurse practitioner is in line with the physician and that they have the same mindset when it comes to your care.
So again, that primary care physician is essentially your quarterback, right? In
Yeah.
theory, they're the ones that would say, okay, here's our plan. We're going to sit down, and then maybe you see this endocrinologist about your hormones. You see this person about XYZ, right? And they kind of, so I don't want people to feel overwhelmed. Like the doctor will make that plan for them.
Absolutely. So in my office, I have a strategic health checklist that I give to my female patients. And it literally just goes, you just have a checklist to make sure you're doing, your pap smears, your mammograms, your bone density scans when that becomes appropriate, vaccinations. And then also we talk about, social integration and, social wellness as well, because all of that makes a difference. But you want to be thinking about that strategically. It's the same thing about, we know social integration is so important. You don't just pop up and make new friends when you're 40, right? It takes sometimes a decade to make a friend, and you need to learn how to make friends and to how to join clubs and how to be a productive community member so that you have that deep social integration. So but all of that is a strategy. You don't just suddenly pop up and do it later, but really thinking about how do I want to live when I'm older, and what is everything I can do to get there through every decade of my life.
Right. So first, we're going to our primary care physician and asking them to help us make a plan. Just ask them. That's a normal, okay, right? I know some people have, hesitancies asking doctors questions or feeling like they should know. I want everyone to know. It's okay to not know. That's what they went to school for. Ask them those questions, right? You're the expert. So you go to your doctor, make that plan. Another thing I think that's important is lifestyle change, right? The way you live. Could you talk about nutrition, just day-to-day things that you can do to create wellness in your life?
Yeah, sure. So, the foundation of your entire life is your lifestyle, right? Now we say your food is what builds your body, right? So those choices we know make a significant impact on your overall health. Really looking at cardiovascular disease, we know 80% of it is associated with risk factors. So we know that the choices you make around food, activity, and some, harmful behaviors can have a significant impact on how you feel now and later as well. So healthy food choices are really like the foundation to everything for me. And then adding in healthy movement and social integration.
I'm curious your thoughts about what drives certain female patients of yours. I know for my mom, for example, I just had a baby. Now it's like, oh, my grandchild. I want to live longer to see my grandchild grow and whatever it is. I think oftentimes women probably need that emotional connection to create a plan. Can you talk about that?
Yeah, absolutely. So we work with patients to discover their why, right? Like, why do you make a choice? Everything really comes back to some type of, usually a somewhat emotional or thought that is driving them to make a choice in their life. And so those are really powerful drivers. So when we connect a choice to an emotion or something is that powerful, a person's more likely to make those healthy choices, actually, than if it's just something that's random or being pushed on them. It's very difficult to maintain something if you're just doing it because you should, right? But if you're doing it because you want to be healthy and able to get on the floor to play with the baby or to see the baby graduate from college or whatever it is, each person has their own unique motivator. And so when we tie in the lifestyle choices to the motivation, it actually has a lasting impact.
And lifestyle choices, not just food, but also exercise as well, right?
Yeah, fitness is important. Really, it's really every choice that you make, right? It's, the people you have in your life and, everything.
The media you consume.
Really, honestly, to the media that you're consuming, what you're reading, and all of it really is a choice. And every bit of it is really building your reality. It's creating the lens for how you experience your life. And then, of course, the food and the fitness literally does, help to modify your entire body. And we know the food even really impacts our DNA. I mean, it's down to the cellular level. So all of these choices are just, they're small, but they have a really big impact.
I love that you're talking about all of this because you're an integrative doctor. Is that correct?
Yeah.
And just for people to understand, typically a primary care physician might just look at things through a medical lens, which is nothing wrong with that. But there's other things, as you said, there's lifestyle and supplements and media you consume, who you're following on social media. And you kind of look at the whole picture. Can you explain what integrative medicine really is?
Yeah, so integrative medicine is an approach of integrating other complementary therapies into allopathic or Western medicine. So you think of Western medicine as, sort of your traditional typical doctor. But then we know there are a lot of other therapies that people use. And the majority of Americans do take supplements. And then people lean on nutrition as well. So, and then there's other traditional healing practices like traditional Chinese medicine and Ayurveda and others as well. So in integrative medicine, what we do is we try to take evidence-based approaches using all of those therapies to help people have a fully rounded approach to their healthcare. So it's not just one or the other. It is the integration. It is the complementary therapies integrated with the Western medicine. So we're always using evidence. We are always following the science. And there is still a lot of science out there that does endorse complementary therapies, especially together with Western medicine.
I love that you say evidence-based because I know just, even seeing some people in my family that you grow up, again, that you revere your doctor and the medicine they give, and then I'm going to use a non-medical term, but some of this other stuff is like woo-woo, right?
Yeah.
But that's not, could you talk about that there's actual data behind what you're suggesting people do?
Oh, yeah. Well, certainly. You look at things that are like yoga or meditation, right? So there's just so much evidence of how helpful these things are, especially when it comes to mindfulness. We know that it has a structural change to the brain when people use mindfulness techniques. So we have a lot of science behind those therapies. They don't make a lot of money, so they don't get the push like the pharmaceuticals and things like that. But we know when it comes to lasting impact, if a person adopts a mindfulness practice, for example, which has a very low cost entry point, low risk for them as well, and that could change their entire lives. And it's very low cost, so you don't get there's no advertising for it per se. So we work with patients on that, especially around like things like sleep and even around eating. People eat a lot to control their stress. And when we work with mindfulness, we learn how to be in the present moment and to see what we're doing, why we're doing it, and then back to that exploration of the why. Why am I doing this? And does this really align with my long-term objective? And then helping to check in with that.
And there's also a lot of studies, real hard numbers that show the links between social media use and depression and even self-harm with young kids.
Yeah, I think we're learning a lot more about that. And then also the break in our social fabric, because we know that deep social integration has a literal impact on our health. It's as important as not smoking. It is so incredibly important. And so when people are isolated because of social media, then they're not integrated into their community. And more than anything, we need to really be banding together and getting out there to know our neighbors and the folks that are really in our current environment close to us so that we can all work together to take care of each other.
All of this to say, you're encouraging women to not just pick up the phone and call the doctor when you're sick, right? That's being reactive. It's being proactive, making these calls ahead of time to whether it's visit the wellness clinic here at Desert Oasis Healthcare, reach out to your doctor to create a plan, just be on the forefront of it all.
Yeah, 100%. If I could have one message, it would be to please use your annual wellness visit. Most insurances have an annual wellness visit that is covered, usually with no copay or with very low cost, to get in with your provider and to really use that as a strategy session. I think sometimes patients think, well, I have one visit with the doctor, so I'm going to try and cover everything, rather than really looking at it as like a strategy session for their year to come up with what do I do this year? What should I be working on? What vitamins, what exercise should I be doing? What are my personal risk factors? Because every person is different. They have a different family history. They have a different personal history. They may have gone through something or a treatment as a child, and that changes their risk factors later. But you need to take the time to talk with your doctor about that and then really come up with a plan.
I know we're hoping to inspire some people in their 20s, 30s who are watching to be proactive and make that plan for ahead. But what about some of the women who are a little bit later in life, who didn't make that plan, didn't wear the sunscreen, didn't take the supplements? It's not too late, I'd have to imagine. What is your advice to them?
It is never too late. So always my recommendation is, no matter the age, get in with and talk with your doctor and see, again, where you're at, because things may be better than you anticipate. And sometimes there's things that we can do to mitigate it. So if they didn't use sunscreen, there's some vitamins and things that we can add that help to reduce their risk of recurrent skin cancer. So it's really just about having that conversation, not avoiding it. Back to the concept of retirement. Like, if you didn't plan for your retirement when you're young, that's okay. A lot of people don't. But if you're aware of it now, then get in and have the conversation. Don't be ashamed of it. And then hopefully you find a doctor that isn't going to ever make you feel bad about that.
I was just going to say, if somebody is, then that's the wrong doctor for you. And I have seen so many wonderful doctors here within Desert Oasis Healthcare who welcome people with open arms. I've had many conversations with you. You just clearly are so passionate about what you do and love what you do. So I know you're one of them. Most of them here are like that. And if for some chance you get someone who makes you feel bad, you're in the wrong office.
Yeah.
I'm sorry, find a new doctor then, right?
Yeah, I totally agree, because it really is a relationship. And we know that studies have shown that the relationship between the doctor and the patient is part of the healing process. We think of doctors often now as like pills and surgery, but the doctor is actually part of the healing. So when you have a good relationship with your doctor and you're excited to see them and you know they're going to give you a nugget of information or something that's cool or inspiring, that's actually part of the healing journey. So if you don't have a doctor that's inspiring you and doesn't care about you, then I would consider finding someone that does.
I know you're celebrating 6 years of your practice, yes?
Yes.
What do you love about what you do?
Oh my gosh, I love being a primary care provider. I love prevention. I love wellness, and then I love coordination of care. Knowing that my patients needed something, and I followed through on the process, and they got what they needed. That's one of my obsessions.
Following from start to finish,
Yeah.
which I know is so important at Desert Oasis Healthcare here.
It really is. And I love the whole spectrum of a person's life. And I've had so many patients that I've taken care of through just, decades. And it's just really fun to have that relationship with someone I have patients that I've had for more than 20 years. And so it's just fun. You just have like that. It's like an old friend where you have just like this, unspoken connection. And I love that about primary care. It makes it really fun. And then I love knowing that we prevent disease. I love that we are helping to reduce the risk factors for heart disease and stroke, the number 1 and number 3 killers of women. So to me, I take it really personally to know that my patients have their blood pressure under control. And that means a lot to me.
Okay, I want to end with a little rapid fire, okay? So in theory, shortish answer, but I know you got a lot to say, so we'll see how this goes. What is your top tip for a woman when it comes to nutrition?
Don't eat animals. Try to minimize your animal products. Meat, dairy, really focus on plants. Plants should be the foundation of your diet.
Okay, top tip when it comes to working out.
Top tip to working out is you need 150 minutes of moderate cardiovascular exercise a week and 2 days of weightlifting.
Okay, so important. That's strength, right?
Mm-hmm.
Top tip when it comes to blood pressure control.
Minimize your salt and also reduce your animal products. Plants reduce your blood pressure.
What about social media?
social media, just minimizing your time, get out and really move in your actual environment and get to know people in your actual community.
You could, I'm sure people who are watching right now feel what I feel. It just emanates through you, your passion and love for what you do. And congratulations on the anniversary.
Thank you.
And thank you for sharing all of this with us,
Yeah,
Doctor.
thank you.